Psychologists, what do people think is normal but isn't? Observation 1. Thinking 5 hours of sleep per night is fine. It's not. Chronic sleep deprivation impacts mental and physical health, yet many normalize it as a badge of productivity. Observation 2. Parental attitudes. Many behaviors parents consider normal, like harsh criticism, emotional neglect, or inconsistent discipline, cause lasting psychological harm. These are often dismissed as just parenting, but can lead to deep emotional damage. Observation 3. Self-sabotaging behavior. People often see self-destructive tendencies as quirks or bad habits, but they can rapidly derail your life. If a negative life event triggers irrational or inconsistent behaviors, seek counseling. You don't need a diagnosed disorder to benefit from mental health support. Observation 4. Overreactions. Excessive reactions to minor issues are often brushed off as an aggressive or impatient personality. In reality, they're a sign of built-up internal pressure, with small triggers unleashing disproportionate emotional outbursts. Observation 5. Euphoria after depression. If someone emerges from a depressive period feeling euphoric, be cautious. It may signal suicidal ideation. The euphoria often stems from believing they've found a way out of their misery, mistaken for recovery. Observation 6. Abusive partner behaviors. People normalize partners who dismiss their interests, encourage only what the partner deems worthy, interrupt conversations to dominate decision-making, ignore or quietly acknowledge good deeds while exaggerating mistakes, or exploit deep insecurities to win arguments. These are abusive, not normal. Observation 7. Normalizing abusive behavior from loved ones. Many accept toxic actions from family or partners as just how they are, ignoring the harm. Recognizing and enforcing personal boundaries for your well-being isn't innate, it's a learned skill. Observation 8. Family dynamics, where everyone works to keep one or more members happy or appeased. This isn't healthy. Individuals are responsible for their own emotional regulation, not others. Therapist perspective. Observation 9. Children's mental health struggles. I've worked with kids with panic attacks, PTSD from assaults, anxiety, or depression. A common thread: they often express distress, but were told they were being dramatic, attention-seeking, exaggerating, or ungrateful. Trusted figures, parents, friends, teachers, counselors dismiss them. They stop speaking up until they implode, their issues too big to ignore. Take kids seriously before they're screaming or at the edge. Observation 10. Unhealthy coping mechanisms. Regular heavy drinking, excessive smoking, or promiscuity to avoid stress are often seen as normal stress relief. They're red flags indicating someone's dodging deeper issues. Psychotherapist perspective. Observation 11. Self-harm. Behaviors like hitting oneself, banging heads, burning, or cutting are not normal and signal a need for professional help, yet they're often downplayed as phases or attention-seeking. Observation 12. Lack of communication. Persistent silence, especially in children, teens, or adults around parents or partners is often mistaken for shyness. It can indicate feeling unsafe or extreme anxiety, requiring professional evaluation. I've seen people silenced by abuse in their homes or unable to speak due to untreated anxiety, even in healthy environments. Observation 13. Mood swings. Frequent. Extreme mood shifts are often dismissed as eccentricity or hormones, but can signal issues like bipolar disorder or PTSD. Many patients are shocked to learn their normal behaviors are anxiety or depression symptoms, like struggling to maintain friendships, constant worry about children's safety, inability to enjoy hobbies, chronic fatigue, or obsessive rumination. Observation 14. Sudden mood or personality shifts. Someone who's been depressed or withdrawn suddenly becoming bright, laughing more, or making future plans, e.g., trips, school, may seem improved. In my work, this often signals suicidal risk, not recovery, especially if they engage more in treatment or set new goals. Genuine improvement is gradual, not abrupt. Observation 15. Dismissing mental health issues. People normalize ignoring depression or other mental illnesses, thinking it's not that bad. Others have it worse, or I should handle it alone. Suffering isn't a competition. You deserve happiness. Seeking therapy or psychiatry isn't weakness. It's learning coping skills or adjusting brain chemistry. Other normalized issues include trauma from cumulative small events, inability to regulate emotions, harsh self-talk, imposter syndrome, mistaken for humility, common in fields like engineering, and neglecting self-care, e.g., hygiene, appearance. I've seen patients normalize extreme abuse, like a father attacking his daughter in the shower for undone chores, thinking it's typical discipline. When someone stops caring for themselves, e.g., not brushing teeth, washing hair, or doing dishes, it's a sign of struggle, not laziness.